we commenced the organisation a couple of years ago for the purposes of bringing high quality home care services to people in our local community, utilising the skills of community paramedics who are not known of in Australia. So overseas, in Canada, America, Scotland, England, yes, community paramedics are quite successful and work really well within the community environment. No lights and sirens, no uniforms. It's more about preventative medicine rather than reactive acute transport and assessment to hospitals. What we found is that community paramedics are not recognised in Australia, and hence the lobbying and the education and the promotion and the advertising and trying to explain to people that paramedics and nurses can provide, paramedics can provide very similar care to nurses with a few different specialty differences, I guess, or different operational differences. But as a unit, paramedics and nurses together really encompass a fantastic holistic way of looking after people in their homes. Paramedicine's not recognised by NDIS, it's not recognised by My Aged Care, it's not recognised by TAC, it's not recognised by the Department of Veterans Affairs. They know nurses, they know nursing, and they speak nurses and they speak nursing. So we've had a really interesting time trying to find a place for community paramedicine within home care services. It's been exceptionally rewarding in a lot of ways. We've got some really lovely testimonies and stories about the amazing work that they've done with people and the amount of times you would have seen the statistics on the video, and some of the testimonies on the video, the times that we've stopped ambulances being called out, and the times that we've prevented people from having to go into the emergency department or the hospital. It's been great, but it's also been a big battle because it's not accepted in the industry. People love the care, they love the professionalism, and they love the fact that they've got access to so many things that a normal support worker can't provide for them, but they don't want to pay the money. The NDIS packages can't support the programs. Nurses are $135 an hour. A support partner is $67. Support worker is $67 an hour. You can get a lot more hours help with a support worker than you can with a community nurse or a community paramedic. So we evolved into, how can we actually utilise the specialist community paramedics more effectively and more efficiently? And that's where we came up with the Cannabis Clinic. So that was our first clinic that we started. There was a physical clinic, but it was also via telehealth. So we've kind of had 1 or 2 days a week with telehealth and a physical clinic in 2 separate locations. We've actually closed one of those physical locations down, and at the moment we're operating out of one, and it's mostly via telehealth at the moment, isn't it, Gabby? I think. Yeah.
It is.
So Cannabis Clinic. So the Cannabis Clinic, the community paramedics and nurses can be trained, and what we do is, rather than the Cannabis Clinic being run by nurse practitioners purely, one of the really important parts of HMS Community is to advocate for the professionalism and the benefits of paramedicine. So the way that we operate the clinics is that the paramedics actually do the initial assessments. They do the triage, they do the they work out the plan and work out what management they believe needs to be done, and they then hand over to the nurse practitioners, who then do the prescribing. They receive handover, either agree or disagree with the decision, prescribe, the patient's dealt with and done. So we have a very different way of running our cannabis specialist clinics. They've been fantastic. That's been one of Gabby's main portfolio projects, and it's been really rewarding to see how many people have had better management of their pain, better management of their sleep, better management of, their mental health and well-being. It's been great. Paramedics are really happy because they're able to use their assessment and diagnostic skills and using their intellect and feeling like they're actually being of value to the community as well. So where do we go from here? So you've talked about evolution. So evolution, yes, we were active with the home care medical services in Geelong and the Macedon Ranges. Geelong was a mistake. We weren't ready for it yet. We've made it redundant and closed it down. We needed a practice manager 12 months ago. If we had a practice manager 12 months ago, it might have been a different story. We weren't comfortable that we were operating safely and to the best benefit of our staff and the people that they were seeing. So we've closed it down, and we've referred our staff and the people that we were looking after to another organisation so that their care's actually been able to continue. But we've withdrawn back to the Macedon Ranges hub to make sure that we get this right and strong before we start expanding any further. So the idea of home care medical services and then the clinic. So the clinic was cannabis, and now we're actually entering into a phase of we're actually building a clinic in Gisborne, which is in the Macedon Ranges, which will be our own home base for a clinic practice, which will have a GP, which will have nurse practitioners, and which will have community nurses and community paramedics operating out of it, which will be the home base for where home care medical services can operate from, and will be the clinical support for home care medical services. So one of the things that we found is they only want support workers. So we can supply support workers, but we can still have them being overseen by the clinic. So at the moment, we call them support partners or care companions. Our support workers are people who've got a health background. So there might be a retired nurse, retired paramedic, or a student nurse or a student paramedic. They've got a lot more experience than just somebody who's decided that they're going to do the Cert 3 or Cert 4 and become a support worker. They go out, they've got experience and knowledge and more awareness about them. They can see that someone's unwell. With us, they ring up the clinic support at HMS and say, I'm seeing Joe, he looks like he's got a chest infection. Can one of you guys come out and have a look at him? I think he needs some antis or, whatever. We'll be able to offer that. Now, that's confusing to the public, and that's confusing to the support coordinators, because hang on a minute, your home care services, how can you be prescribing and administering antibiotics and putting in an IV and, doing all of these things? So it's caused conflict and confusion. So we're thinking that if we separate home care medical services completely but have it overseen from the clinic, there is a referral to the clinic, and then the clinic will go out and see these people. So it's no different to what we've been doing, but it looks different and it will come across as different, so it will hopefully be more acceptable. The other thing is, by starting a clinic, and this is where we've been working really closely with Jasmine and her team in Cygnet in Tassie, is that they've been so progressive with what they're doing there. They're a very interesting organisation to research and to go and have a look at. We've had a visit down to them earlier this year, and it's inspired us even more to keep going with what we're doing. And this is why people tell me to shush, Sophie, because I get passionate about it and I talk too much.
No, but it's very informative. It's beautiful. Thank you.
No, that's
it's
okay.
Very, very informative, and I like that. Yeah.
So we do want to establish a clinic that will have a GP. Now, that's for a few reasons. One of the reasons is we'll be recognised and able to obtain funding a lot more easily. We'll be able to offer our services out more easily. We'll have a home for our staff. At the moment, we've had no home office. Everyone's been working from their own place, and so we want to have that feeling of that togetherness and team and group, which is something that came across very strongly from Cygnet, Jasmine. And we're really hoping that we'll also be able to give the community paramedics and nurses a place where they can actually thrive and, be their best professional selves and working in their best capacity as well, without being necessarily relied on for just doing showering and taking people out for a cuppa and stuff like that, when they can be put to work for a lot more effective purposes than that. So that's the answer to how many clinics do we have. We don't have any. We have one that's going to be built finished maybe in a couple of weeks. We're really looking forward to getting that up and running. We really